Chronic pain can be one of the most difficult things in the world to live with. It can take over a person's life, driving out hopefulness and leading to an overwhelming feeling of helplessness. But there is more to the treatment of pain than over-the-counter medicine and waiting for better days. At Lakecore Medical Center, we are taking every step possible to help people bear the burden of chronic pain and come out the other side. Medical treatments are available, and in the hands of a doctor with expertise in anesthesia and pain management, progress can be made. In a moment, I'll tell you more about the sophisticated ways that Lakecore is attacking and overcoming chronic pain. Sometimes the cause of chronic pain is known, sometimes not, but in either case it places a tremendous burden on the sufferer. People dealing with long-term, unalterable pain often feel that in addition to physical suffering, their pain causes degrees of memory impairment and loss of focus, not to mention the deep psychological impact of waging a constant battle. At Lakecore Medical Center, we take this issue very seriously. We have a board-certified anesthesiologist on staff and a series of effective options to treat chronic pain. We understand the degree to which pain can alter your whole existence and will travel with you every step of the way to find relief. I'd like to outline 4 of the most effective options we have to treat chronic pain. Before any of these are chosen, your doctor will examine you and get a complete picture of the specifics of your pain, its origin, its location, its effects, and whether there are any likely causes for it that may have been missed. One of the possible options for pain treatment is an epidural injection of steroids. Pain can sometimes be caused by nerve root compression, which leads to inflammation. If you have a herniated disc, spinal stenosis, bone spurs, or a number of other conditions, when a nerve becomes compressed, it becomes inflamed, which leads to pain, numbness, tingling, or weakness. Put simply, spinal steroid injections can reduce the inflammation, lessening the pain and symptoms, and giving the area a chance to heal naturally. Treatment of this type should provide relief within a day or two and requires follow-up within 2 to 6 weeks of your appointment. While epidural injections are a general treatment, reducing inflammation in an entire section of the spinal column, selective nerve root blocks try to zero in on the precise area from which the pain is emanating. If the doctor believes he can identify this area, then the smaller, more focused injection can not only alleviate suffering, but also confirm the diagnosis of where exactly the pain is coming from. These injections are often the treatment of choice for pain associated with herniated discs. While procedures like this have existed for many decades, Lakecore Medical's C-arm machine provides a cutting-edge tool in helping our doctors perform them with exceptional accuracy. A third course of treatment is the injection of anesthetic and steroids directly into what are called facet joints. Facet joints are parts of the spine that bear weight and help control movement between individual vertebrae. Compression of these joints can lead to chronic pain in many parts of the body. Doctors have long been injecting steroids around these joints, but it has recently been shown that injections directly into the joint can both alleviate pain and confirm the exact location of the injury or problem, leading to better treatment. Facet joint injections are usually recommended for patients with degenerative disease of the facet joints and can be helpful in relieving pain for up to 6 months at a time. Finally, sometimes the cause of chronic pain is muscular in nature. Normal muscle contracts and relaxes when it is activated. A trigger point is a knot or tight band of muscle that forms when a muscle fails to relax properly. Trigger points can trap and irritate the surrounding nerves and cause pain, which, because of the way that nerves conduct pain, can sometimes be felt in a completely different part of the body. Lakecore's anesthesiologists can treat this condition with the injection of an anesthetic, sometimes combined with a steroid, directly into the trigger point, alleviating the pain. This method can work for muscle groups in the arms, legs, lower back, and neck, and has also been successful in treating tension headaches and fibromyalgia. If you've tried everything you could to fight chronic pain, we understand what you've been living through. We want to help. We have the expertise, the latest and ultra-modern equipment, and we're taking advantage of cutting-edge research. You don't have to prolong your suffering needlessly. Call Lakecore Medical Center for a consultation appointment today.